So we're going to do a mommy makeover. It's going to be a fantastic case. We have a patient who had a gastric sleeve. You can see her scar here. She actually lost 95 pounds. So you can see when you lose that much weight, you can have a lot of skin. So we're going to take care of all that. So that's why we got to do a tummy tuck. You can see there's a lot of stretch mark in her skin, and then she has excess skin here. Look, when I lift this up, I'm going to pull up. You can see how her thighs pull up a little bit too. So I'm going to pull all this up, and you see how this area is going to tighten too. And this is the amount of skin I'm going to remove right here. Almost all her stretch marks, except for these few little ones. I mean, almost all this will be removed right here. And then this point, it's actually going to come all the way down. Once we tie this separation, you can see that separation in her muscle. I'm going to tie it to where she has a scoop abdomen to make her a great looking belly button. I explained to her, you know, belly button, you really have to do it correctly the first time, because if you mess up on a belly button, it's hard to fix. I just have patients come in and they want belly button revision, but you know, when you have a large belly button, you can't really fix it because you're gonna have scars around it. So you know, really important to do it right the first time, and we're gonna show you guys how. And so that's gonna take care of this abdominal area. So you can have a tight scoop abdomen. You can take care of everything, and then we're gonna do a little liposuction in her waistline. I don't like patients to be kind of squarish still after a tummy tuck. I always contour her waistline. And then I'm going to take some of that fat and go ahead and inject it into a little bit inside the buttocks where she lost some volume. And it's normal to lose some volume in the buttocks when you lose that much weight, you know, like 90, 95 pounds or so. So that's going to be fantastic. And then with her breasts, I'm going to show you, I'm going to hold up a picture of kind of like what we're working with. Now, this is what she wants to look like with the bra. Sometimes without the bra, she wants the full cleavage. So I marked out where her cleavage is going to be. You can see it right here. These number 7 basically represent how far her nipple is going to be from this midline. We want to be the same, and we're going to lift both of them up, and we're going to do what's called Mastopexy, and then we're going to put a pair of silicone implants up here underneath the muscle to give her that nice fullness. So she wants up, round, perky breasts, you know, no more hanging breasts. So we're going to do a Mastopexy combined with a augmentation with silicone implants. So we got a lot of work to do, so let's get started. Okay everybody, so this is her 1 week follow-up. So her drains are out, and so this is as you remember from her previous video, she had a large protrusion here. Now it's just really flat. This incision here is from her gastric bypass, so you know, obviously we couldn't remove that. But this is her belly button here. So if you look at her belly button, a true test is when you look along the side, how it sinks in. It's a nice oval belly button. It's not large and round. So that's gonna look really good. All the swelling kind of settles down here where the incision is. You can see that, and that's all gonna flatten out later. But for 1 week out, this looks terrific. She has a nice waistline. You can see here, this is all contour. The incision only comes to here. Although she had all that skin hanging here, we're able to contour that with the liposuction, so we kept the incision short. And if she wears a bikini like this later on, you're not able to see anything. And so she looks great for 1 week. She's moving around okay, and so we'll continue to monitor her, and she's gonna do terrific. All right.